Hi everyone, my name is Emily Ballard, and today I'm going to be giving you a presentation on excise taxes on alcohol consumption and tobacco products. What is a sin tax? Well, a sin tax are taxes that have been put in place on products that are unneeded and harmful to humans. Two examples of these products are cigarettes and alcohol. By having an excise tax on alcohol and tobacco, since they are a health risk, will ultimately impact people's behavior. From my research, you will see that individuals are not buying as many cigarettes due to the alarming increase in price per pack. Due to this, the rate of adolescents smoking cigarettes is decreasing rapidly. Individuals are turning to other options like over-the-counter prescriptions in order to help quit their habits. Individuals, including adolescents, are not drinking as much due to other options being available. Due to this, there are fewer medical risks associated with drinking since consumption is decreasing. I chose the following three measurable factors because I will be able to figure out if the excise tax on these luxurious products has an effect on individuals. I chose the effect on teenagers and adolescents specifically due to the higher medical risks they can receive. By reducing the consumption and informing adolescents, there will be fewer alcohol-related fatalities over the years, and a positive effect of tip campaigns and over-the-counter medicines will help reduce medical risks. Why was the excise tax on cigarettes and alcohol put into place? The purpose of excise tax on alcohol was first imposed by the Distilled Spirits Tax Act of 1971. Most of the origins of excise tax on distilled spirits, wine, champagne, hard apple cider, and beer started in the 1860s. Congress created the Internal Revenue Act of 1862, which was enacted in July 1862, which created a tax on some luxurious items like liquor. The Senate enacted the excise tax to fund the federal government costs for the Civil War to help pay for operating expenses and pay off debts that were incurred during the time. Senator John Sherman believed the country's challenge was raising money in order to secure enlarged revenue. It is known to be one of the most searching, thorough, comprehensive systems of taxation ever devised by any government. Then, on June 30th, 1864, along came the first excise tax on tobacco products, including cigarettes. After the war ended, the tax on these luxurious products stayed. The excise taxes were chosen to go into effect because they are domestic commodities which customers valued. To start, a change in the federal excise tax on cigarettes affects cigarette consumption through two avenues. By raising or lowering the cost of tobacco products to the consumer, an excise tax increase or decrease affects the decision whether to smoke and the decision of how much to smoke. The federal excise tax on cigarette increased from 7 cents to 8 cents, but then later doubled in 1983 to 16 cents per pack. By 1964, campaigns were starting to explain the harmful effects of cigarette smoking and to restrict advertising by cigarette manufacturers. In January 1992, the federal tax on cigarettes was increased from 16 to 20 cents per pack, with another 4 cents per pack added in January 1993. During this time, there was a tax on the state and local level too. In 1921, the first state to tax cigarettes was Iowa. The last state was North Carolina in 1969. All the 50 states have a state excise tax on tobacco. There are also 43 states that have a general sales tax that applies to cigarettes as well. By January 1st, 2000, the federal excise tax on cigarettes jumped from 24 cents per pack to 34 cents per pack. The following year, on January 1st, 2002, the federal excise tax on cigarettes became 39 cents per pack. The federal excise tax on cigarettes increased from 39 cents per pack to $1.01 per pack, effective April 1st, 2009. This increase represents a 321% increase in the federal excise tax. Distilled spirits, wine, and beer are all taxed at different rates. Before the 1990s, the federal tax on distilled spirits did not increase from 1951 to 1985. Also, the taxes on beer and table wines were not increased since 1951. In October 1985, the rate was raised from $10.50 to $12.50 per proof gallon. Under the Over 90 Act, the rate was increased by $1 to $13.50 per proof gallon, effective January 1st, 1991. The legislative history seems to indicate that excise tax on alcohol was primarily to raise revenue. The Craft Beverage Modernization and Tax Reform Act and the Tax Cuts and Jobs Act was the first major change Congress made to the federal alcohol excise tax since 1990. The Internal Revenue Code was amended up until recently when Donald Trump signed the Tax Cut and Jobs Act on December 22, 2017, which made extensive changes to the Internal Revenue Code in 1986, including provisions related to the alcohol administered by the TTB. The new alcohol laws that are put in place are effective for the calendar years 2018 and 2019. Trump reduced the beer tax rates, made 3 different credits available on wine produced by the producer, adjusted the alcohol content for certain still wines, and reduced distilled spirit tax rate, along with rules for a controlled group and single taxpayer. The first measurable factor for the excise tax on cigarettes is sales versus price. In 1954, 45% of people used to smoke, whereas in 2018, only 16% are smoking. The price increase does have an effect on consumer consumption because over the span of 40 years, the price of cigarettes have almost tripled. According to the Alcohol and Tobacco Tax and Trade Bureau, the total tobacco excise tax collections have been falling since the fiscal year 2003, from $7.9 billion in that year to $7.7 billion in the fiscal year 2006. The CBO projects total tobacco excise tax receipts to decline from $7.5 billion in 2007 to $6.7 billion in 2017. This shows the excise tax on tobacco and cigarettes have been more effective. That is because cigarette smoking kills roughly 350,000 Americans every year and is the single most preventable cause of death and disease in the United States. My second measurable factor is how high school adolescent usage is decreasing rapidly. 12th graders have cut down on smoking since 1976 by a little over 25%. 10th graders have cut down on smoking by almost 11%, and 8th graders have cut down on smoking by almost 6.5%. Lastly, my third measurable factor is how individuals are turning to over-the-counter prescriptions. Tip campaigns are also available. Tip campaigns are an effort to help roughly 1.6 million smokers give up smoking, which has added roughly 300,000 years to the U.S. population, and have made the dangers of smoking a topic of discussion for over 6 million non-smoker friends and family members. These tip campaigns are a huge effort in reducing medical risks for consumers. Many users are also quitting cold turkey, or gradually cutting down, or turning to other forms of tobacco. Consumers turning to meetings and over-the-counter medicines are causing the number of consumers to decrease at an alarming rate. Excise tax on alcohol has also played an effect on sales decreasing. U.S. alcohol consumption dropped in 2018 for the third straight year of declines. The main culprit is the beer slump, with consumption of the classic American adult beverage down 2.8% since 2015. Sales are also decreasing when it comes to lower income groups, which have a price sensitivity compared to wealthier drinkers. They may also reduce their consumption due to the tax increase in alcohol. This is also causing teenage usage to decrease. Adolescents from the age of 12 to 20 years old have slowed down on alcohol consumption by almost 2% from 2002 to 2012. Lastly, this is causing medical risks and alcohol-related fatalities to decrease. Various factors have been suggested for the decline, including health consciousness among millennials and the increasing availability of marijuana as an alternative. Between 1982 and 2006, there has been a decrease in alcohol-related fatalities by 62%. Vaping devices, also known as e-cigarettes, are battery-operated devices that people use to inhale an aerosol, which typically contain nicotine, though not always, flavorings, and other chemicals. Vaping devices are popular among teens and is now the most common used form of nicotine among youth in the United States. There is currently only an excise tax at the state level. Each state has a different tax rate depending on the following: the manufacturer's price, the wholesale price, or the parallel tax rate. I believe more can be done when it comes to the excise tax on cigarettes and alcohol. I believe there should be an excise tax on e-cigarettes under IRC Section 5701. The significant rise in e-cigarette use among both student populations has resulted in overall tobacco product use increase of 38% among high school students and 29% among middle school students between 2017 and 2018. The majority of all e-cigarettes typically deliver nicotine, which exposes adolescents to addiction and can be harmful to the developing brain. While many adolescents have quit cigarette smoking, they're turning to other alternatives like e-cigarettes because advertisements tell them that they are not as harmful as cigarettes. However, there has been an increase in fatality and lung injuries due to vaping in the United States. There have been 1,479 people who have been diagnosed with lung disease from vaping, along with 33 deaths that have occurred. There is currently no excise tax on e-cigarettes. I believe more should be done on this due to the alarming spike in e-cigarette usage over the years and the medical risks associated with these products. When it comes to the new tax law Donald Trump put in place from eliminating an excise tax on alcohol consumption, I believe it lowering the federal alcohol excise tax for 2018 and 2019, the sunsetting effect should not be permanent. Alcohol consumption has been slowly decreasing over the years between adolescents and adults, which has an alarming decrease in alcohol-related fatalities. However, we should not be taking these statistics lightly due to the health risks associated with alcohol consumption.